So my doubt is this is a name-based question,
Okay.
and there is name.
One you said name is there, Cancer Council.
Yeah, Cancer Council name is there. So
Okay.
first we'll school where is the name, and there is contrast also. So my doubt is which one will choose? This answer came from the topic sentence.
Now the thing is, what is the method?
Question,
Question,
Quest-
text.
question, text, option.
That is for the beginners, right? You are
Okay,
not a
fine.
beginner, right? See, all the methods what I teach you in the initial stages, it's for the beginners, okay? So normally, once you are not a beginner, if you're a beginner, definitely you have to read the questions, then go to the text and identify that question term and all that, then come back to answer options, then see the answers, all those things. As I said, once you are advanced learner, you will not have to even read some of, maybe 40% of the paragraphs you will not have to read. Or you have to read only a portion of it. So QAT method means question,
answer,
Question,
option,
answer,
text.
then text.
Text.
So normally, when you are on the run with the programs, you have to go question, answer, then text. Why? When you see the question and read the answer options, here you will find, read the answer option, there are many health benefits of alcohol. Okay, many health benefits. Okay, let's just highlight. Then the benefits of drinking red wine to prevent or treat heart disease is conclusive. Benefits,
Conclusive.
conclusive.
Here it says many health benefits. Here it says benefits conclusive. Here the evidence that alcohol can prevent or treat heart diseases inconclusive. Here there is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer. Safe level of drinking 1 or 2 standard drinks a day. Okay. Normally you have to go from question, then answer, then to the text. Now what is the strategy to be used here from the options?
Inconclusive is an opposite. Two opposite.
Yeah, these are two opposites. So what happens if there are two opposites?
Other two are immediately eliminated.
Other two are automatically
Eliminated.
So you have to choose only between these two. And always keep this in mind. Whenever you read, your whole focus should be on the topic sentence. That tells you whether you have to go further or not. Now, what have you have to decide whether the benefits are conclusive or inconclusive? So you have to now, but what about the health benefits of alcohol? As I said, this is a question, not a, that's not the topic sentence. It's a way of asking and answering. They themselves are, well, the evidence is inconclusive. The evidence is inconclusive. That is the topic sentence. So what will be the topic sentence? If you write the topic sentence, let me try. I'll just try to write without question. I'll try to write the topic sentence here. I just wrote this question and answer I summarized. This is the summary of this one. Summary of the question and answer. But what about the health benefits of alcohol? Well, the evidence is inconclusive. Now, the Cancer Council advises. Name is there. How do you say this is the advice of the Cancer Council? Whatever comes in between comma can be ignored. That is the explanation of the same thing, right?
Yeah.
It says inconclusive and potentially flawed at present. The Cancer Council says this can be summarized this way. The Cancer Council says that heart health benefits of alcohol is inconclusive. So if you take all these together till here, this is a summary, right?
Yes.
This is a summary. The Cancer Council says that the heart health benefits of alcohol is inconclusive. Says advises. Says advises. Is that clear? Maybe Sini has a doubt. Sini's doubt is also connected with the next question, right?
Yeah, this clear, Father. If there is
This
no
clear.
next question, so this
Okay.
clearly is saying after the however,
Okay.
the same, the synonym and question and the text also is showing synonyms. However,
Okay.
given the risk, the Cancer Council suggests
Where is it?
after
Down.
however,
Yeah.
after the contrast word. However,
Yeah.
Cancer
However,
Council suggests,
okay.
yeah.
Suggests that anyone who wants to drink should stick to the National Health and Medical Research Council guidelines, no more than 2 drinks. You mean this one, B, right? Let me
Yeah.
remove.
Yes.
Let me remove it.
Yeah.
Let me remove it and highlight in a different color. It's a good doubt. Yeah. Now you are saying, why can't this be right?
Yes.
We'll come to that. And you say this is the one, right? However, is here. After that, you have Cancer Council that anyone who wants to drink, how much we should drink? No more than?
2 standard drink.
However, given that the risk increases with amount, the Cancer Council suggests that anyone who wants to drink should stick to the National Health and Medical Research Council guidelines.
Father, it's the guidelines of National Health and Medical Research Council. No
Okay,
more than 2 standard drinks a day.
Yeah, I'm waiting for the response of other people. No, I want you to think. That's why I slow it down. See, now there are two organizations here. One is Cancer Council. Other one is NHMR. NHMRC, National Health and Medical Research Council. Okay.
National Council suggests to follow the guideline of National Health and Medical Research Council.
Okay. Now, is it the opinion of Cancer Council or NHMRC?
NHMRC.
But it suggests you can use it. Does it advise? For example, my suggestion that Sini should start thinking. But Amanpreet Kaur said Sini should start dancing. Or I say, my advice is better you start thinking now about the paragraph. But then I also say, if you want, you can take the suggestion of Amanpreet Kaur and do this dance. So it is my opinion, which is my advice.
Think about the paragraph.
Now, Sini's doubt is Cancer Council suggests. Let's take this way. Now, what are the common words in these? I'll just remove. It's good to think. Good to think. Okay. Now, what are the common words in these options?
Benefits.
Benefits, right?
Yes.
Speaking about benefits. Now, drinking, does it say it's a benefit?
Drinking.
Without, if you don't, does it say if you don't drink, you will have cancer?
No.
No, right?
No.
See, some people are very particular, drunkards are very particular. They should have 1 drink or 2 drinks, otherwise they cannot sleep. So this is something like this. The tone of the paragraph is this. Come on now, drinking is not good. Okay? Listen to me. Come on now. Please don't drink. No, doctor, I can't sleep. I can't do anything. I can't do anything. Come on, then. In such cases, you do one thing. The Cancer and NHMRC says maximum 2 drinks. Does it mean drinking 2 drinks is a benefit of?
No.
No.
Is it beneficial? No, it's because nothing is clear. Because already they are saying the evidence is inconclusive. We are not sure drinking will help, but it can harm you. Do you get me?
Yes. Yes, Father.
Drinking, the very first topic sentence says there is no evidence to say drinking is safe. But then the man says, no, I heard people say if I drink a little, it is good, that the worms will be dead in my stomach and I can cool and all that. Come on, if you are very particular, it's not sure that will help or it is beneficial, but drink maximum 2 standard drinks. Do you get me?
Yes, Father.
Yes, Father.
Ultimate, simply think as a common layman. He is drinking good or bad?
No.
It's not good. It's not good. And people are saying drinking causes cancer. Or if cancer patients drink, their situation will be very bad. So if at all you are drinking, take just 2 packs, 2 standard packs, not more than that. Is it the advice of Cancer Council?
National Health and Medical Research
No,
Council.
MSM.
Yeah.
Cancer Council is saying there is no evidence it helps. The evidence is inconclusive. Okay? Imagine, let's take some other example. Since it's not live streaming, you can take any example. So let's take one example. What is it? Smoking, take smoking. Okay? Smoking, there is no evidence, smoking is good. Do you think there are some benefits? No, no proof at all. But doctor, I cannot sleep without smoking. See, you are a cancer patient, it's not good for you. But then if you are very particular, max 2 cigars a day. 2 cigars a day. Is that my advice? Doctor's advice?
No.
Smoking is beneficial to health?
No.
So, yeah. Now the thing is this, since there are 2 questions, there is a confusion. Normally there will be, if there are 2 questions, one paragraph. But then there is a safe level of drinking. This one say, anyone who wants to drink, എങ്കിലും കുടിക്കണമെങ്കിൽ.
Yeah.
Right? If anyone wants to drink, if you are very particular, don't drink more than 2 standard drinks a day.
Yeah.
Does it say there is a safe level of drinking for everyone?
No, Father. Now it's understood, Father. Clear. Yes, Father.
Okay.
Yeah, their Cancer Council advice is don't drink. There is no benefit. It's inconclusive. But if anyone want to drink, you can take the standard drink. That is the advice of the National Health and yeah, I understood. Yeah.
And please don't take coming 3 days because war is going on. So many injured soldiers are coming to the hospital. And we don't advise the health professionals go on leave these days because the war is going on. However, if somebody is very particular, make sure that you don't take more than 1 day leave. Does it mean I am suggesting that you should take 1 day leave? No. My advice is please don't take. War is going on anytime. Injured patients, critical patients can come in. Please don't go on leave for this 3 weeks. But if at all somebody is very particular, you want to go for a honeymoon picnic, take not more than 1 day. So the question is, what is the advice? My advice. Is it to go one day picnic?
No leave.
Oh, you got the tone, right?
Yes, Father.
Don't worry. If you are able to grasp this, you can score out 500 out of 500. If at all you understand this perfectly well. Because this is a bit challenging, means the tone, everything, that is only for 450 above people we teach. Otherwise, in the previous explanation, I haven't taught it. See, the message to consumers, the message to our dear drunkards is this. Okay? There is no evidence to suggest there is a safe level of drinking. Option D says there is a safe level of drinking.
Yeah, the opposite.
Opposite. Yeah, thank you. That's how you have to collaborate with the teaching. Because how your mind works, you know better. I'll tell professionals. That's the opposite, right?
Yes, just opposite.
Yeah. You can understand even that way. And the reading passages are so sweet. The more you dig, more you find. More and more evidences you will find to say this is the answer. Okay, so QAT question. That's not for beginners. If there are beginners, you have a different method which I have taught. You start with that definitely. Question, you highlight the stem words, hedging words, question stem. Then go to the answer options and highlight the differentiating on concept-based hedging keywords. Then you realize there are quite opposites, conclusive and inconclusive. Then your business is other two are eliminated automatically. Okay, other two are eliminated.
Father.
Yeah, please.
I would like to add to you one strategy.
Yeah.
Once the question has came, you should look for only a topic sentence. The answer itself, we can find it in the topic sentence, as you said.
Yeah.
I think no need to go the entire
Yeah,
paragraph.
that's what I said. Once you read question stem and answer options, you have eliminated 2. Now your business is to find out whether evidence is conclusive or inconclusive. So always see that you glance at the topic sentence. That helps you in any way. Whether it is name or anything, that you'll have to find what the answer. No? The topic sentence will tell you what is the stand of this paragraph. Okay? The stand is clear. The Cancer Council says that the heart health benefits of alcohol is inconclusive. Means there is no proof. There is no proof it's going to benefit you, which means it's going to hurt you. The other way is there is no proof it will benefit you means the other way to say is it can hurt you. It can hurt you. There are proofs that alcohol can hurt you, but there is no proof it cannot hurt you. So when you read this, Cancer Council says that this highlighted brown thing is the topic sentence, and I have summarized here. The Cancer Council says that the heart health benefits of alcohol is inconclusive. What is the advice of Cancer Council is the clear question. And you will understand better. We go to the next question from the same paragraph. These paragraphs are very useful, okay, because you can save a lot of time. Reading once, you have 2 answers. 1 paragraph. Let's check 13th one, right? 13th one. Now you see the other person comes. First was Cancer Council. Who is next?
National Health and Medical
Research Council. What you can do when you practice, at least, you can simply highlight this and write NHMRC. NHMRC. This all helps you to use your analytical skills. Just write NHMRC in short. No? Then you go. Now you have here, they're asking guidelines suggest. What is the suggestion of? National Health and Medical Research Council. Cancer Council says, please, don't drink. National Health and Medical Research Council, there are in that. Sorry. Okay, since it's not like I can say anything now. Okay. So it says you can drink 2 drinks a day, 2 drinks okay. That doesn't Cancer Council says it okay. Drinking more than 2 standard drinks a day. This is more than 2.
More than 2.
Now only thing you have to see what is the quantity to drink. Drinking 100 ml of wine or 20 ml beer. Okay, then drinking at least 2. At least 2 means, if possible, you have to drink 20 standard drinks. At least 2 you have to, right? Okay. At least 2, yeah. Drinking 2 standard. Okay. Now you have to immediately go to the name. Where is the name? National. This is what I said. You need not waste your time anywhere reading anything. This part you need not write, right? That's why I said a contrast word is there. You can see that. But here, when the name is there, even you can bypass contrast word. When there is a name, you can bypass even contrast word. There is a however, right? That can be bypassed when there is a name. There's the advantage of name. Here there is a contrast word, right? But then that tells you answer must be after that. But even you need not look into that. Go to the name, then see what they say. No more than 2 standard drinks.
No more than 2 standard drinks.
Which is the option?
D.
C.
C.
Yes.
C. Is it D? C says at least 2 drinks.
D.
If possible, 10 or 20 drinks. C says at least 2. Here it says no more than 2.
No.
Option D is answer.
2.
Option D answer.
2 or less. D is
Option
the
D, yeah.
Yeah.
Yeah. Option
D
D is the answer. 2 or less. No more than 2 means you are not forbidden to drink 1 drink. If you can drink 1, that's enough. That's better. But don't drink more than 2. The D option says drinking 2 standard drinks or less.
Or less.
Maximum 2. NHMRC says maximum 2. No more than 2 drinks. Means what? You can drink
Maximum is 2.
you can drink
Maximum
less. You can drink
less
less.
than 2.
Yeah,
Less
but
than
then
2.
no, never more than 2. But then here it says drinking 2 standard drinks a day or less.
Mm.
Okay?
Yes. Okay.
Yeah. Here it says if you want these numbers, you can see. What is this?
This
Option
is standard
B.
one drink.
Yeah, 1 drink means what? That says 1 drink means what? So B option says you can drink, you have 1 drink a day. And HMRC is not saying only 1 drink a day, maximum 2. That's what their opinion. They did not say 1. 1 means more than 1 you cannot take, right? Okay.
Yeah.
Yeah. So the A option is more than 2 drinks. Maybe 10 drinks, 20 drinks, 200 drinks, whatever. Option B says 1 drink. Option C says at least 2, like for A option. At least 2. More than 2 is anything is allowed. Fourth says drinking 2 standard drinks. Exactly after the name you have 2 standard drinks a day.
Yes, Father.
So clear. I think this is from the official OET website. Thank you, OET, for allowing me to use this for the teaching purpose. Is that clear, Siri?
Yes,
Father.
Father.
Yeah.
Yes, Father.
Immediately, any session, immediately you can ask any questions, any blunders that will help others to understand. You know, otherwise, if you won't teaching, you will not get it to your brain. Yes,
Yeah,
somebody wanted
because
to add?
B is always confused, no? That's why now it's all clear.
Yeah.
Thank you,
Now,
Father.
yeah. Now I will put it another way for Seema. Now, imagine couple of apples are there. I am telling Ganesh, you have to distribute the apples. Okay. First option is give more than 2 apples to everyone. Second option is give only 1 apple to everyone. Option C is give at least 2, which means you can give more, right? Option A and C is 2. And I said just give 2 each, not more than that. Never give more than 2, it will not be enough for everyone. Never give more than 2. So what is my advice? To give more than, A option says give more than 2. Option B says give only 1. Option C says at least 2 must be given. Option D says give only 2. Not more than.
Only 2.
B is 1, okay. That is explained here. 1 standard drink is 100 ml of wine or 285 ml of beer. Don't worry, Seema. Since you are not in the habit of drinking, you will find it a bit challenging. Okay.
Now,
Yeah.
now clear. Thank you.
Okay. Ganesh can understand it better. Yes. Okay. Okay, then. Bye-bye. God bless you.
Thank you,
For some-
Father.
Thank you,
For,
Father.
for some, you have to go for your breakfast, some have to sleep, some have to take lunch.
Thank you, Father.
Thank
Whatever
you.
Thank you, Father. Have a good
Bye-bye.
day. Bye bye.
Thank you so much. Thank you.